Hi everyone, it's Emma here, and this week I am talking through the question, can IBS cause extreme fatigue? So as with everything, especially IBS, this is very individual in terms of your symptoms. So fatigue might not be a very obvious symptom, but it certainly is one that is commonly associated with IBS, and the research also backs this. There is research to suggest that IBS and fatigue are often commonly linked. So for me, as always, saying that IBS and fatigue are linked doesn't really tell us much. It's not that helpful. So for me, I really want to help dive into exactly why fatigue may come hand in hand with IBS, and then of course what can be done to help manage those symptoms. So I'm just going to dive straight in and talk through some of the common causes of fatigue and how this could be linked to IBS. So number one on my list is the inadequate absorption of key nutrients. So this one for me is crucial. IBS is very often linked with digestive insufficiency. So perhaps your stomach isn't working quite as well as it should. Further down, your small intestine is where a lot of absorption of our key nutrients happens. The stomach acid kind of sets the tone for that, but much of the absorption happens in the small intestine. But of course, if the stomach isn't working properly, we're not releasing enough gastric juices, that nice strong gastric acid, then the small intestine also can't do its job, and that can create a whole host of other issues as well. So initially, what I would often recommend for people to do is to try and take some herbal bitters such as your yarrow. Of course, if you're able to incorporate bitter foods into the start of your meals, that's absolutely brilliant, a good alternative. But this is quite often helpful. It's especially bitter, it's convenient, and it can help just to get a dose of that bitterness in your mouth 5 to 10 minutes before meals. So that's often a good place to start in terms of trying to get your digestion working a bit better and really supporting the absorption of lots of those lovely key nutrients, because of course there's so many nutrients we need to help keep us feeling energized. You've got iron, B12, the other B vitamins, magnesium, vitamin D, just to name a few. There's so many, so that will help to support the overall absorption of all those nutrients rather than just concentrating on any one particular nutrient. Number two, in terms of IBS and why fatigue might be an issue, your eating habits might have changed. So this could be a result of just lifestyle, or it could end up being a result of your symptoms. So then you try and alter your habits in order to try and manage those symptoms. So perhaps the timing of your food have changed. If you're skipping meals, if you're going for long periods without meals, then you might suffer in terms of your energy levels. Or it might be the types of food that you're opting for, again, just generally or as a result of the IBS. So a general example could be having more caffeine or refined sugar. We know that as much as these give us an instant energy hit, our blood sugar will rise quickly with refined sources of sugar or caffeine. We then get the drop. We then get that trough in energy levels as a result of your blood sugar crashing as well. So that's just one to consider, how your habits might have changed, how they might be influencing your energy levels, and just to see if there's anything you can do around that. So trying to eat regular meals, some snacks in between perhaps, always with a good quality protein or healthy fat in there, not too many refined carbs, and considering perhaps your caffeine intake, if you could swap in some caffeine-free options, some nice herbal teas, something like that, depending on how you think your habits may be having an effect. So as well as we've got eating habits, we've also got lifestyle habits. Again, could have changed generally or in response to your IBS symptoms. So just a few examples here I have is in terms of moving, in terms of that exercise, and also sleep. Again, if we get into the habit of moving less, this can affect our metabolism, our energy levels in general. It can also go on to affect our sleep, so those two are actually related as well. The more we move during the day, the more likely we are to feel tired and sleep better at night. Sleep is important in its own right. Whenever someone says to me, I'm looking for something to improve energy, or energy is a factor, the first thing I ask is, are you sleeping? If the answer is no, that could very well be a direct influence on that. We need to be sleeping well and for enough time and undisturbed as much as we can in order to feel energized the next day. So again, with sleep, it can be trying to work out what might be causing the sleep issues, but there's different factors in terms of your sleep hygiene routine at night, your diet, how and when you're eating in the lead up to bedtime, and of course there are herbal helpers if you feel you just need something a little bit extra, something like our dormiazan containing a combination of the herbs valerian and hops. Number 4, in terms of fatigue as a result of IBS, could be an imbalance of good gut bacteria. These bacteria live in your large intestine and are so important for supporting a number of bodily functions, including our metabolism and energy levels. Again, this could happen as a result if your stomach's not working properly, you're not breaking down your food properly, larger particles of food are travelling into your small and then large intestine, and these bacteria are feasting on these. So sometimes just supporting your stomach can be a really good place to start with those lovely bitters such as yarrow. Sometimes it could be a more a quicker change in bacteria as a result of illness, food poisoning, a bug, something like that. So in that case, the bitters would still work because you need strong acid to keep bacteria in check. But something along the lines of a pre and probiotic combination could help to set that more specific imbalance right. So our Mulkazan Riccinelle plus lactic acid is a nice one just to support the internal environment of the gut. And then a probiotic from a professional brand such as Optibac could help to just support that specific hormone imbalance. So they've got different varieties, ones for those on antibiotics, for example, which could have directly influenced that good gut bacteria. Number 5, just to touch on quickly, there could also be an imbalance in neurotransmitters, and we know there is a well-established gut-brain axis. So this means your gut is very connected to your brain, and the other way as well. It's a bi-directional relationship. So neurotransmitters such as serotonin are very prevalent in the gut, as well as affecting our moods and our energy levels and things. So there could be quite a pronounced imbalance in that system. So again, if this is a good place to start, as always, would be, as things we've mentioned here, supporting your diet, fresh foods, fresh nutrients, cooking from fresh, limiting those processed options with lots of artificial sweeteners and those negative extras that could be having an effect. Sleep, direct influence on your mood, as is exercise. Those endorphins that are released are very good for supporting your mood. So these are all good places to start. But of course, if there's a more pronounced issue in terms of mood and affecting your energy levels, then it would be worth chatting to your doctor in case some medication is required just to help you overcome that. Stress is another potential factor when it comes to fatigue as a result of IBS. So stress can be totally draining both physically and mentally, and just as we mentioned with that gut-brain axis, there is strong links with IBS. Stress also directly influences your stomach, decreases that important stomach acid, and that can have a kind of domino effect throughout the rest of your system on those gut bacteria and everything. So again, much like the mood side of things, everything you do in your diet and lifestyle, no matter how small, could have a positive influence on stress. Stress, of course, can be quite individual. The exact source of stress is quite individual to you. So in terms of how you manage that, it can be somewhat individual. But there's lots of lovely stress management techniques out there. Again, individual to you, what works well. But exercise, moving a bit more is a common one, but just finding some time to do what is stress relieving for you as an individual. Of course, there are also some herbs which can help if you think stress is quite underlying in it all. So something like our Passiflora tablets could help to kind of support that stress response as well. Last on my list is pain as well. So this is just one to touch on when we're thinking about IBS and how these symptoms could be affecting your energy levels. So pain itself can be really, really draining depending on the severity of your symptoms. Also, there's lots of crossover with pain and other symptoms of IBS and other conditions as well, such as chronic fatigue syndrome. So as always, it's important just to track and track your own symptoms. And as always, if your symptoms are severe, persistent, then it's absolutely time to go to the doctor. So that goes for the pain or any of the other symptoms that we've mentioned today, because we can only do so much in terms of diet and lifestyle and supplements, but there comes a point where it's often necessary that we go to the doctor for a checkup and just to see if there's anything extra that we need to be doing. So hopefully that helps. I think that's the end of my list. As always, please feel free to comment and ask any questions. Please do subscribe to our Avogo YouTube channel and hit the bell icon so you will be notified of any future videos. Thanks.